Assalamu alaikum. This is Shama Tuzara, and today I'll discuss the major feature of acute pericarditis, that is pericardial friction rub, and how we'll differentiate a pericardial friction rub from the pleural friction rub. Fine. So this is a very important point, that if we know the two things, then we will never confuse when we're performing clinical examination or when we're examining a patient. So we'll exactly know that if a rub is head, I'm hearing a rub, friction rub on my stethoscope. So what exactly it is? Is it a pericardial friction rub or is it a pleural friction rub? It's very important. So let's start our discussion over it, how we will master over this topic, and inshallah we will. Okay, so pericardial friction rub. Starting from the very first point, that what is the character of this rub? Character of the sound heard. So basically, these are the extra hard sounds. Fine. Pericardial friction rub. Its voice is grating and scratching in nature, and it is a very high pitch voice. It is so loud that it can even at some times masks the normal heart sounds. I'll write HS for heart sounds. This is pericardial friction rub. Talking about the pleural friction rub, when we compare both the sounds heard, then pleural friction rub is less louder than it, and it is lower in intensity. Second important point, talking about the site where we'll best hear it or where it is exactly heard. So for remembering the pericardial friction rub, its site where it is best heard is that, imagine this is the patient and this is the sternum of the patient, not central, but sorry for it, and this is the heart. Fine. So this is the apex of the heart and this is the sternum. So midpoint between the apex and the sternum, this is the point where the pain of a pericardial friction rub, not pain, pericardial friction rub is best heard at this point, midpoint of apex and the sternum. Fine. The pleural friction rub, it is heard on the chest wall. On the chest wall, it can be heard anywhere on both sides of the chest wall. Talking about the third point, that is that what are the components of this sound? The sound that is heard, what are its components? It is a very important point to exactly differentiate the both, that in pericardial friction rub, the voice sound has three components. Differentiating it from pleural friction rub, it has only remember, only two components. Fine. So these three components are, we change the color so that you can easily recall. First, it has one systole component and two diastole components. One systole and two diastole. These two diastole are at the time of early ventricular diastole and late or end of ventricular diastole. Fine. And these components are only two. So when you'll hear the patient and it has two components, patient is having two components of the pericardial friction rub, then it will be very ambiguous. It will be very difficult to differentiate between pericardial friction rub and the pleural friction rub. But as soon as you hear the third component, you'll be 100% sure that it cannot be pleural friction rub, it is pericardial friction rub. That is the importance of this point. Fine. Now there are some associations, and that is even important, that the pericardial friction rub, AW, is association with its association with, first there are two associations. First we are talking about breathing. Now the pericardial friction rub, it is heard both during inspiration, during expiration, and it is even heard even its inspiration, during expiration, and it is even heard when there is no breathing or the breathing is stopped. Differentiating it from the pleural friction rub, it is only heard, very important, I repeat, it is only heard during the inspiration. Fine. So what kind of voice would be there? Imagine a voice. This is a voice coming. Voice would be heard during inspiration as the patient will breathe. Expiration, no voice. Make it here somewhere. Expiration, inspiration, voice is coming. No voice during expiration. Then again voice is coming. Again no voice. So this is the character of the pleural friction rub. This hard sound. Thirdly, Stethoscope Association. It is best heard. However, pericardial friction rub, it is best heard during expiration, but it can be heard in both phases and even when there is no breathing. But during expiration, it is best heard. Talking about the Stethoscope Association, sorry, I'll just write the word stethoscope. I forgot to write stethoscope. In pericardial friction rub, whatever you do, whether you apply the diaphragm or put the diaphragm of the stethoscope tightly on the chest or loosely, if you increase the pressure of the diaphragm on the chest, there will be no increase in the pericardial friction rub, no change in the pericardial friction rub. But in the pleural friction rub, what happens is that its voice, it increases when we tightly place the diaphragm against the chest wall. Against chest wall. So these are some features by which you can easily differentiate or even tell someone if someone asks you in your viva or during your clinical practices, or if you're a doctor and you're practicing it and you don't know this feature, then this can easily be cleared. Fine. I hope after watching this video, now you can easily differentiate between the pericardial friction rub and the pleural friction rub. A brief overview, summary of the whole discussion. In pericardial friction rub, it is grating and scratching in nature, high-pitched voice, and even so much high that it can mask the normal hard sounds. Pleural friction rub, it is less louder, lower in intensity. Site of pericardial friction rub is a midpoint between apex of the heart and the sternum. Pleural friction rub is heard on the chest wall on both sides. Components of the sound. Pericardial friction rub has 3 components, 1 systolic and 2 diastolic. Pleural friction rub has only 2 components. Association with breathing. Pericardial friction rub, it is not associated with breathing. It is heard during inspiration, during expiration, and even if the breathing sounds or breathing movement is stopped. But it is best heard during expiration. Talking about the pleural friction rub, it is only heard during inspiration. It is a very important point. It will help you out. It can even come in your MCQs, or somebody can ask you relation with the stethoscope. In pericardial friction rub, there is no change if you apply the stethoscope tightly to the chest wall or a bit loose, or the pressure is increased. No change for the pericardial friction rub. But pleural friction rub voice will increase tightly placed if the diaphragm of the steth is placed tightly against the chest wall. So this was my whole discussion today. I hope it helped you out. I hope it clear your concepts, and please at the end like, share and subscribe my video. Thank you so much. Allah Hafiz. See you in the next video.